Hello and welcome to the 2019 Education Minnesota ESI Member Benefits Medicare Made Easy webinar. My name is Gretchen Huber-Schomer and I'm a benefits specialist with Minnesota Health Insurance Network. Minnesota Health Insurance Network is an independent agency that manages the Education Minnesota Group Medicare plans. Today we will discuss Education Minnesota and Minnesota Health Insurance Network and how we are connected, the fundamentals of Medicare, then we will talk about the Medica group plan offerings, the UCare group plan offerings, and last, the Humana group plan offerings. At the end of the webinar, you are welcome to type in any questions that you might have, or you are always welcome to contact me at your own convenience. Minnesota Health Insurance Network is an independent agency with over 25 years of experience in the health insurance industry. We are located in Burnsville, Minnesota. We represent all of the major healthcare providers in Minnesota. We help seniors shop to better understand their options with Medicare and ways to supplement their coverage. And we offer exclusive group Medicare benefits to Education Minnesota members. As you can see on the screen in front of you, we do work with all the healthcare providers. However, the Education Minnesota group offers plans from 3 insurance carriers. So if you do have questions about plans from other carriers, please feel free to contact me for further information on those. Now let's talk a little bit about Medicare. As you can see in front of you on the screen, this is a picture of what your Medicare card will look like. If you will be turning 65 and you are drawing Social Security, you will receive this card in the mail automatically within the 3 months prior to turning age 65. If you are not drawing Social Security and you will be turning 65, you will want to go apply for your original Medicare Part A and Part B at the Social Security office, or you can go on to the website www.medicare.gov to apply as well. You can see on the card it's going to have your name, a Medicare number, and then your Part A and your Part B effective dates. So what is Medicare? You might ask. Medicare is a government program developed for the nation's aged to provide financial benefits for health-related occurrences. It covers a range of Medicare-approved medical services such as inpatient stays, hospital stays, physician or outpatient visits, and your prescription medications. How do you qualify for Medicare? You qualify for Medicare in one of 3 ways: when you first turn age 65, or if you have become permanently disabled for 24 months, or if you are diagnosed with end-stage renal disease, which is also known as kidney failure. How is Medicare divided? Well, original Medicare, which is the coverage you get through the government, is divided into 2 parts. You have your Part A, which covers your inpatient hospital stays. And with that, if you only had original Medicare coverage through the government, you would have a deductible that you would need to meet each year before your benefits would start. Your Part B covers your outpatient or your physician services. With your Part B, you do have a monthly premium you do need to pay to the government each month. If you are drawing Social Security, it will be taken out of your Social Security automatically. If you are not drawing Social Security, you will be billed for your Part B monthly premium quarterly. With your Part B, you also have a deductible that you need to meet before your benefits begin. And once you meet that deductible, you have a co-insurance that you need to pay for your services. With original Medicare, there is no maximum out of pocket, so you will always continue to build up your medical bills. Another part of Medicare is called Part C. Part C is also known as a Medicare Advantage plan. Medicare Advantage plans combine your Part A and your Part B, your medical services, and it also includes your Part D, your prescription drug coverage. Part D, your prescription drug coverage, you can also enroll in a separate plan for your prescription medications. Let's talk about the costs of Medicare. Your Part A is at no cost to you as long as you or your spouse has worked 40 quarters in your lifetime. Your Part B is a monthly premium. In 2019, the monthly premium for new Medicare beneficiaries is $135.50. However, the Part B premium is based on income, and Medicare looks at your income from 2 years prior. The income guidelines are if you are a single tax filer and your income is over $85,000, you will have an additional premium above and beyond the $135.50. If you are joint tax filers and your income is higher than $170,000, then you will also have a higher monthly Part B premium. Now these premiums can change because, like I said, they do look back at the previous 2 years. So if your income has changed each year, then your Part B premium can adjust as well. You are always welcome to contact Medicare to appeal your Part B premium to see if you are able to bring that down if you have a different lifestyle than you did the 2 years prior. Your Part C is going to be optional because it's going to be based off of the plan that you decide to go with. And your Part D is also going to be optional because that's going to be based on the type of plan that you enroll in for your prescription medication coverage. Let's talk a little bit about the different enrollment periods. The initial coverage election period is the enrollment period when you first turn 65. You have a 7-month window. You have the 3 months prior to your 65th birth month, the month of your 65th birthday, and the 3 months after your 65th birth month. This is when you can apply for your Part A and your Part B through Social Security. Then there is the annual election period, which is also known as open enrollment. This takes place each year, October 15th through December 7th. Open enrollment is a time for Medicare beneficiaries to change their plans if they choose to, and then their new plan will begin on January 1st. And there's also what they call special election periods, and those are for special circumstances, such as when you retire and you decide to come off of your employer plan and start Medicare, or if you decide to relocate or move out of your service area. However, you are able to enroll in an Education Minnesota sponsor group plan at any time. Now let's talk a little bit about the different types of Medicare plans that you can enroll in to fill in the gaps and holes of original Medicare. The first type of plan we'll talk about is a Medicare supplement plan. The Education Minnesota group plans do not offer any Medicare supplement plans to enroll in, but we will give a short detail of what those plans consist of. With Medicare supplement plans, Medicare is the primary payer. So Medicare pays first for your Part A and Part B, and then your insurance company will fill in the gaps and holes. Being on a Medicare supplement plan, you are usually able to see any provider in the U.S. that accepts Medicare. If you decide to relocate or move, you are able to take Medicare supplement plans with you when you move. Medicare supplement plans only cover your medical services. These do not include your Part D or any coverage for prescription medications. You would need to enroll in a separate Part D plan if you needed to enroll in coverage for prescription medications. Now let's talk about the cost plan. Cost plans are available in 21 counties in the state of Minnesota. Cost plans are also known as a type of hybrid plan because Medicare is the primary payer for your Part A services and your insurance carrier is the primary payer for your Part B services. With cost plans, you're going to receive your best benefits when you stay in network in your service area. However, when you are out of the service area, you are able to see any provider that accepts Medicare for your in-network benefits. With cost plans, you are able to include your drug coverage or just take the medical part of the cost plan. However, if you live in a county where you need to enroll in a cost plan with the Medica plan option, you do not have the option to not take the drug coverage. These plans with Education Minnesota group plans have the Part D coverage included in all of the plans. And the last type of plan we'll talk about is a Medicare Advantage plan. A Medicare Advantage plan is where Medicare assigns the rights to the insurance carrier. So the insurance carrier is the primary payer. They now take on all the risk of your medical bills. With Medicare Advantage plans, we do recommend that you see the providers that are in the plan's network to receive your highest level of benefit coverage. Travel benefits vary by plan, so you always want to take a look at that plan to make sure it's going to cover you for where you're going to want to be traveling. The Medicare Advantage plans that we offer through the Education Minnesota group plans do include your prescription drug coverage. Now let's cover the Part D and the coverage gap. With your Part D coverage for your prescription medications, there's going to be 3 different levels of coverage. The first level of coverage, stage 1, is when the insured is going to meet their deductible, so they will pay for their medications until they reach their deductible for the Part D. Once they reach their deductible, if they do have one, they will then pay their copays or coinsurance until the total retail cost of the medications equal $3,820. And that's an annual cost. So that means between you and your insurance company, you've spent a total of $3,820 in prescription medications. Once you've reached that, then you step into the next stage, which is stage 2, the coverage gap, or also known as the donut hole. Once you're in stage 2, then the insured is responsible for 95% of the cost of their brand drugs and 37% of the cost of their generic drugs until they reach their true out-of-pocket cost of $5,100. Now, the true out-of-pocket costs are what you've already spent out of your own pocket for your deductible and your copays and coinsurance in stage 1, and then what you spend for your brand drugs and your generic drugs in stage 2. However, the nice thing is that when you're in stage 2 and you're responsible for 95% of the brand drugs, you really are only going to have to pay 25% coinsurance out of your own pocket because the drug manufacturers give a discount. You still are responsible for the full 37% of the generic drugs. But once you've reached that $5,100 in true out-of-pocket costs, you step into stage 3, which is also known as the catastrophic coverage level. Once you're in that stage, then you will only be responsible for $3.40 copay or 5% coinsurance on your generics, whichever is greater, and an $8.50 copay or 5% coinsurance on your brand drugs, which is ever greater. There is no maximum out-of-pocket on your Part D plans. You will continue to pay your prescription medication costs. And this is for an annual term. So January 1st, the clock resets for your medication costs. So you may want to ask yourself what you should look for in a Medicare plan. The first thing that we advise is that you take a look at your medications and make sure that they are on the formulary of the plans that you are looking at. You want to take a look at the costs, the out-of-pocket costs for those medications, and what the monthly premiums will be for you. You want to take a look and make sure that you're going to be having your doctors or your health system covered by the plan, as well as any hospitals or pharmacies that you use. And then you might want to think about if you've been with that insurance carrier before, were they dependable and reliable? Did they have good customer service? Were they friendly? Did they help you with any type of issue you may have had in the past? In front of you is some resources that we put together. If you have any questions, your Social Security Administration phone number is in front of you if you need to call there to set up an appointment to go in and apply. You may also go to that website, www.medicare.gov, create an account and apply for your Part A and your Part B that way as well. You can always give me a call with any questions that you have at the phone number there on the screen in front of you, or you can visit our website, www.educationmn.mnhi.net, to view all of the different plan options, the different ways to enroll in the plans, and we also have a nice spreadsheet. It's called an overview of all the plans side by side to compare to see what plan might be the best option for you. Next, we will learn of the Medica group plan offerings. So in 2019, the Education Minnesota ESI group plans available to Education Minnesota members are based off of counties. In 2019, the cost plan went away in 66 counties in Minnesota. So if you live in the 21 counties on the lower part of the screen, you are able to enroll in Medica's cost plan. If you live in the counties on the upper half of the screen in front of you, you are able to enroll in the Medicare Advantage plan with Medica. With the Medica Medicare Advantage Solution Plan, you do need to be enrolled in Medicare's Part A and Part B. You need to pay your Medicare Part B premium to the government. You must not have end-stage renal disease unless you are coming off of a Medica plan. And you must permanently reside in Medica's 66 county Medicare Advantage service area. To enroll in a Medica Prime Solution cost plan, you must also have your Part A and B, or only Part B. You must pay your Medicare Part B premium to the government still. You must not have end-stage renal disease unless you're coming off of another Medica plan. And you must permanently reside in a Medica cost plan service area. Now let's take a look at the Education Minnesota Medica group plan options. You can see on the screen in front of you that there are two plan options available. Group Plan 70123 is also referred to as Plan 2. Plan 2 has a monthly premium of $273.10. You can see all the different copays that go along with the different medical services. Plan 2 has a maximum out-of-pocket of $1,500. Plan 2 also has gap coverage, which means that if you are a Medicare beneficiary who takes medications that are expensive or that push you into the donut hole, this plan will give you coverage while you are in the coverage gap and help pay for some of those medications. So an individual who might have higher costs for medications may want to look at this plan to enroll in. The other plan option, group number 70125, is also known as Plan 6. Plan 6 has a monthly premium of $138. You can see the different copays that coincide with the different medical services. Plan 6 has a $3,000 maximum out of pocket. With Plan 6, there is no coverage in the gap for your Part D coverage. So you would pay those co-insurances while you are in the donut hole. An individual who wants a lower premium, doesn't have a lot of out-of-pocket costs for medications, or maybe doesn't take any medications at all, may want to look at this plan to enroll in. Now, for 2019, Medica's Medicare Advantage Plan Network is going to cover any Medicare-approved provider at the in-network benefit level. So what that means to you as a Medicare Advantage member is that even if you were to access medical services from an out-of-network provider, Medica is still going to pay those at the in-network benefit level for you. That's an advantage of being on the group plan. Medica has a formulary that consists of more than 3,200 prescription medications. It has a 5-tier formulary. They cover over 67,000 retail pharmacies nationwide, and they have no preferred pharmacy limitations. So you're going to pay the same copay based on the plan that you enroll in at any pharmacy, as long as they are a Medica pharmacy. CVS Caremark is the mail service for Medica, and you get the benefit of only having to pay 2 copays for a 3-month supply. You can order refills online anytime, anywhere, and you're able to also set up automatic refills for most maintenance medications. Let's talk a little bit about the extra value benefits and services of Medica. Becoming a Medica member, you will receive a Silver Sneakers gym membership, which gives you access to more than 14,000 gyms nationwide. Medica also offers an in-home fitness kit where you can have access to 1 fitness kit each year. And then with Silver Sneakers, you're also able to track your fitness progress and find useful health information on Medica's website, as well as print off the Silver Sneakers membership card. Medica has a nurse line available 24 hours, 7 days a week, and also a personal advocacy support line 24 hours, 7 days a week, where you can ask questions about claims, network providers, or how to schedule appointments, or anything else you can think of. You also have access to your plan information 24/7 by going to mymedica.com or putting the app on your iPhone or your smartphone or your iPad or your computer. If you decide to become a Medica member as a Medicare Advantage member or cost member, you will then receive a member ID card in the mail along with a welcome member packet. If you do have any questions about your Medica plan in regards to billing or claims or benefits, you are always welcome to call their toll-free 1-800 number, 8 a.m. to 8 p.m., 7 days a week. Or you can also log on to medica.com and go into your own account to look at information. Next, we'll hear from Amy at UCare on the UCare Group Medicare plan options available to you as an Education Minnesota member.
Hello, this is a presentation of the 2019 UCare Group Medicare Plan. UCare serves more than 80,000 Medicare members across Minnesota and western Wisconsin. For more than 30 years, we have been serving members on public programs like Medicare and Medicaid, so you may not know us. Our members, however, do know us, and they rate our UCare plan 9 out of 10 in satisfaction. We are a Medicare Advantage plan. You need only show your UCare card at the doctor's office when you're on our plan. You may have heard that Medicare cost plans are sunsetting at the end of 2018. UCare is not a cost plan, so our plans will continue to be the same into 2019. Our members don't have the only say in how we're rated. Medicare rates plans independently on a 5-star rating system in 5 service categories. UCare Group Medicare has been and continues to be rated 4.5 out of 5 stars. Who can join UCare Group Medicare? Education Minnesota retirees and their spouses who have Medicare Part A and Part B, live in Minnesota or within 26 counties in Wisconsin, and do not have end-stage renal disease. Those with end-stage renal disease have a special Medicare plan that they can use to get their coverage. You have a choice of 3 plans with UCare Group Medicare. The high plan is great for someone who favors lower co-payments and would like rich drug coverage. That plan is $339 per month. The core plan at $175 per month has middle-of-the-road co-payments and a middle-of-the-road premium. The basic plan is a good plan for someone who doesn't go to the doctor much and is okay with paying higher co-pays to use services. That plan is $79 per month. The UCare Group Medicare network is very large. In fact, 96% of those providers that are practicing in Minnesota are within the UCare network. Those clinics include Allina Health, CentraCare, Essentia Health, Fairview, Health East, North Memorial, Park Nicollet, Stillwater Clinics, U of M Physicians, and of course the Mayo Clinic. Did this bright slide get your attention? It's to tell you about the features of the UCare Group Medicare plans. All 3 plans include preventive services at no copayment. That would be your annual physical and routine tests like a colonoscopy or mammogram. Our plan also includes preventive dental at no copayment. All 3 plans include Medicare Part D, so you'll get your prescription drug coverage through these plans. The medical out-of-pocket maximum on all 3 plans is $3,400. You will choose a primary care clinic while on this plan. You can find your clinic in the primary care clinic listing, which is in each of the enrollment packets. You can change this clinic anytime, and this is just a home base, but you do not need to have this doctor sign off on seeing any specialist. A primary office visit is a $15 copay on all 3 plans. Let's say that you get admitted to the hospital. That will be covered at 100% after a copayment. On the high plan, that copayment is $100. On the core plan, it's $200. On the basic plan, the copayment is $300 per day, days 1 through 5. While you're in the hospital, you will be visited by countless providers. We take care to coordinate all of those services for you so that you can focus on getting better and going home. Now let's say you have a knee replaced and you need some rehabilitation. For the surgery, the copayment would be $200 on high, $250 on core, and $250 on basic. For that skilled nursing and rehabilitation after surgery, you can head into that right away because there is no 3-day inpatient hospital stay requirement in order to get that service covered on the UCare plan. While in skilled nursing, you'll pay $0 for days 1 through 20. Most rehab services last about 3 weeks. If you need more coverage, you'll pay $100 per day for days 1 through 100. So what happens when you're on this plan and you need emergency medical services? You are covered. There is worldwide emergency care available to you through just a copayment, $50 for high, $75 for core, and $75 for basic. If your emergency room visit ends up with a hospital admission, then you pay the inpatient hospital copayment. If you need an ambulance to go to the hospital, that is also covered at 100% after a copayment. On the high plan, that's a $100 copay, as well as on the core plan. The basic plan has this service for a $200 copay. In addition to benefits you have for emergencies, you have benefits out of network for non-emergencies as well. You can use UCare Anywhere, where you would pay the same copay out of network as you pay in network to see a primary care doctor, a specialist, an occupational or physical therapist, and even a mental health visit. You also have 80% coverage for non-emergency, non-urgent medical services anywhere within the United States. You can travel out of the service area up to 6 consecutive months, and there's no need to notify us of your comings and goings. Our plans have vision and hearing benefits. On the high and core plan, that vision exam you have where you get fitted for a pair of eyeglasses is $0 copayment. You have a $150 eyewear credit. Simply get your eyewear anywhere. Submit to us a paid receipt, and we'll send you a check for up to $150 each year. The hearing exam, where you would be fitted for a hearing aid, is also $0 copayment. There is a $500 hearing aid reimbursement every 3 years. The basic plan covers those vision and hearing exams as a specialty copayment of $40, and there is no eyewear or hearing aid credit on the basic plan. We have dental. You get those preventive dental benefits that I mentioned earlier of 3 cleanings, 2 exams, and bite ring x-rays every year for no additional cost. If you'd like, you can add additional dental coverage for things like fillings, crowns, and dentures with our rider for $21 per month. It includes a full mouth x-rays and a $50 deductible. It pays up to $1,200. All 3 plans include prescription drug coverage with Medicare Part D. The formulary is our list of covered drugs. You can search for your particular drug online by name and learn what tier it falls under: generic, preferred brand, non-preferred, and specialty. UCare has a large pharmacy network and a mail order service through Express Scripts. We have some preferred pharmacies. Those preferred pharmacies include Walmart, Sam's Club, Cub, Costco, CVS, Lunds & Byerly's, and much more. At those preferred pharmacies, you'll get a 90-day supply of your medication for 2 copayments. More than 200 preferred pharmacies were added in 2019. Here is how the UCare Group Medicare plan covers prescription drugs. First, you will pay an annual deductible. On the high plan, that's $100. On the core plan, it's $200. And on the basic plan, it's $400. However, if you're taking only Tier 1 generic drugs, you are not subject to meeting that deductible before you can start paying these low copayments. For those Tier 1 generics, there's a $10 copay for a 30-day supply on the high plan and a $12 copay on core and basic. For those Tier 2 preferred brand drugs, it's a $40 copayment for a 30-day supply on high and a $45 copayment on core and basic. For a Tier 3 brand drug, the copayment is $100 on all 3 plans. For a Tier 4 specialty drug, you pay 30% of the cost on the high plan and 25% of the cost on the core and basic plan. You pay these copays and coinsurance until the full cost of your drugs equals $3,820. If it has reached that amount, you have fallen into the Medicare donut hole. Let's talk about that in the next slide. More than 80% of our members never reach this gap. But here's how it looks if you do reach $3,820 in annual prescription costs and you've fallen into the coverage gap, otherwise known as the donut hole. With the high plan, you are covered just as you have been through the gap. There is no donut hole for you. This type of coverage for drugs can only be found in group plans. With the core plan, generics will be the same $12 copay through the gap, and brand names will cost you 25%. On the basic plan, you will pay the increased costs of 37% of the generic drugs and 25% of the brand name drugs. You will pay these costs until your out-of-pocket cost reaches $5,100. At that point, you've fallen into catastrophic coverage, and you'll pay 5% of the cost, or $3.40 for your generics and $8.50 for your brand names. Now let's talk about the fitness perks with a UCare Group Medicare plan. You can join Silver Sneakers, which is a free gym membership to a fitness center near you. There are over 13,000 locations nationally, and you can use it anywhere you travel. In 2019, Bronze and Gold Lifetime Fitness Centers are included in Silver Sneakers. For those clubs that are not in Silver Sneakers, you can enjoy the Health Club savings, which is $20 towards a membership, reimbursed to you each month. On either plan, there are no minimum number of visits. You go as often or as little as you would like. How do you join UCare Group Medicare? Contact us and we'll send you an enrollment folder. Retirees and spouses may enroll when they are Medicare eligible. The enrollment folders include 2 applications and 2 plan choice forms. Each retiree and spouse fills out their own application and plan choice. Spouses needn't be on the same plan. Simply mail the forms in the green envelope that's provided in the folder. That's it. Welcome to UCare. Once you fill out an application and we process it, you'll get a confirmation of enrollment letter, as well as a member ID card. You'll have access to our customer service, and a UCare nurse line is available to you for 24 hours a day, 7 days a week. We have several disease management programs that you may want to take advantage of. Also, you'll be able to log into the member portal at ucare.org. Do you have questions about the UCare Group Medicare plan? Please give us a call. You can reach us at 612-676-6900 or call us toll-free at 1-877-598-6574. Email us at groupsales@ucare.org. Also, visit our offices. We are available for walk-ins. Our address is 500 Stinson Boulevard, Northeast in Minneapolis. Thank you so much for your time today learning about the plan. We wish you a happy and healthy retirement.
Thank you for taking the time to listen to this presentation about the Humana benefits that are being offered to you through Education Minnesota. Prior to discussing your benefits being offered to you through Humana and Education Minnesota, we would like to take a few minutes to discuss Medicare in general. Medicare is broken up into different parts and are categorized by letters. Parts A and B, as in boy, are called Original Medicare. Part A is hospital insurance, which covers your inpatient care, your skilled nursing care, and hospice care. Part B is medical insurance, which covers your outpatient services such as doctor's office visits. Parts C and D are offered through private insurance companies and are called Medicare Advantage plans. You can have a Medicare Advantage plan that only covers your medical services, or a Medicare Advantage plan that covers pharmacy services, or a plan that combines the both. The plans being offered to you through Education Minnesota is a Medicare Advantage plan that covers your medical and pharmacy services. I would like to share with you a guideline that all Medicare Advantage plans must follow. If a service is covered by Original Medicare, so Parts A or B, the Medicare Advantage plan must also cover those services, and all Medicare Advantage plans are required to follow Medicare's guidelines in terms of determining medical necessity. There are a variety of arrangements that a person can choose when they are a Medicare beneficiary. I will focus on a Medicare Advantage arrangement as that is the benefit being offered to you through Humana and Education Minnesota. The Medicare Advantage plan that's being offered will combine your medical, so your Parts A and B, and your pharmacy coverage, Part D. You will have one card, which will be a Humana ID card that you will use when you go to your doctor's offices, hospitals, or pharmacies to pick up your prescriptions. Humana is based out of Louisville, Kentucky, and we currently have over 8.8 million members. Humana's plan offers you a broad network nationwide, and we have been working with Medicare since 1987.
The type of plan being offered to you is a Preferred Provider Organization, or a PPO. With this plan, you have in-network benefits and out-of-network benefits. If you see a provider outside of Humana's network, you may pay more for your services. Your plan includes an out-of-pocket maximum, so the most that you'll pay over the course of the year. You have no copays for preventive care at in-network providers. And the plan also includes worldwide emergency coverage. We will be focusing on your in-network benefits. Please refer to your plan materials for additional detail on your in- and out-of-network benefits. This plan does not include a deductible. Your annual maximum out-of-pocket, or the most that you will pay for covered services over the course of a year, is $6,700. Your cost share or your co-pays and co-insurance varies by the types of services you receive and where you receive those services. As a high-level overview, at the hospital, when you're admitted, you will have a $454 per day copay for days 1 through 4. Outpatient surgery at a hospital will be covered with a $250 copay. Should you see a physician, your primary care physician office visit would be covered with a $15 copay, while your specialist office visit would be covered with a $50 copay. Services at an ambulatory surgery center are covered with a $200 copay. The emergency room is covered with a $90 copay, which is waived if you're admitted within 24 hours. Urgent care depends on where you receive your services. If you go to your primary care physician and the primary care physician's office bills an urgent care visit, you will have a $15 copay. If you go to the specialist, it will be a $50 copay. Urgent care visits at an urgent care center is covered with a $25 copay. Your Humana plan is also including coverage that's not covered by original Medicare. We are including benefits for routine dental, routine vision, and routine hearing. Please refer to the plan materials for additional information. Your routine dental at an in-network Humana provider has your oral exam covered with a $0 copay, and you can get up to 2 per year. A bite wing set is 1 per year with $0 copay. And there are 2 preventive cleanings per year that are included in your plan with a $0 copay. Fillings are covered at 50%. Your routine vision as an example is just your eyeglasses or contacts. Your exam has a $75 allowance, meaning that the plan will pay up to $75, while your lens, frames, and contact lens has a $100 allowance. Medicare does not cover hearing aids. However, your plan has including some coverage for hearing aids. Your routine hearing exam is covered with a $0 copay. The fitting and evaluation, you have up to 3 per year, is covered with a $0 copay. And depending on the hearing aids that you select, you will pay either $699 or $999 copay. Please refer to your plan materials for coverage specifics and information on additional covered services. You are also welcome to call Humana. We would like to take a few minutes to discuss your pharmacy benefits. Your drug list or formulary is broken into 4 separate tiers. Tier 1 are your generic medications. Tier 2, your preferred brand name medications. Tier 3, your non-preferred brand name medications. And Tier 4 are your specialty medications. You do have a $350 deductible with this plan. However, that deductible does not apply to medications on tiers 1 or 2. The deductible only applies to medications on tiers 3 and 4. Also, you have a mail order option. Humana's mail order pharmacy is Humana Pharmacy. If you elect to utilize mail order, you will receive some savings for Tier 1 and Tier 2 medications. Tier 1 medications at mail order are covered with a $0 copay, and Tier 2 medications at mail order are covered with a $131 copay. You are also able to receive your 90-day supplies at your local pharmacies. If you elect to get your 90-day supply of medication at a local pharmacy, you will pay 3 times the copay, so a Tier 1 medication will be covered with a $12 copay. Something important to note is that if you do take a medication that is on Tier 4, you are not able to get a 90-day supply. Tier 4 medications are only filled with up to a 30-day supply. We would like to spend a few minutes to briefly discuss the phases of a prescription drug plan. Medicare Advantage prescription drug plans are broken out into 4 different phases: the deductible, initial coverage, coverage gap, or sometimes referred to as the donut hole, and the catastrophic phase. As we discussed previously, Tier 1 and Tier 2 medications do not have a deductible. The deductible only applies to Tiers 3 and Tier 4. When your cost, so what you have paid and what the plan has paid, reaches $3,820, you enter the coverage gap, or the donut hole. While you are in the coverage gap, you will pay 37% of the cost for generic medications and 25% of the cost for brand name drugs. The 4th stage most people do not reach, but there are some people who will hit the catastrophic coverage stage. You enter the catastrophic coverage stage when your costs reach $5,100. In the catastrophic stage, a person will pay $3.40 for generic medications, $8.50 for all other medications, or 5%, whichever is greater.
You have the option to have your prescriptions delivered by mail. Humana's mail order pharmacy is called Humana Pharmacy, and we have the pharmacies located at 3 different locations within the United States. They are in Arizona, Texas, and Ohio. If you would like to utilize Humana Pharmacy, you will need to set up an account and have your provider provide you with a 90-day script.
A question that often comes up are how Medicare Advantage plans cover vaccines and diabetic supplies. Medicare Advantage plans are required to follow Medicare's guidelines, and Medicare covers certain items under different parts of the plan. I'm going to touch on diabetic supplies first. Medicare covers diabetic testing supplies, insulin pumps, insulin for the insulin pumps under the medical or Part B portion of the plan. Diabetes medications, regular insulin, and syringes are covered underneath the pharmacy or Part D portion of the plan. The other category that gets questioned are vaccines. Vaccines are divided between the Part B or medical and Part D pharmacy portion of the plan. I'm going to touch on the 3 most common vaccines, which are flu, pneumonia, and shingles. Flu and pneumonia are covered underneath the medical portion of the plan. Shingles is covered underneath the pharmacy portion of the plan. If you get the flu and pneumonia shot at your local pharmacy, the pharmacies do know how to bill the medical portion of the plan, and the experience will be seamless to you. If you get the shingle shot at your physician's offices do not file to the pharmacy portion of the plan, so you will be required to pay for your shingle shot and then submit a claim to Humana under the pharmacy portion of the plan to be reimbursed. One note, the tetanus shot is covered under the medical portion of the plan in cases of injury. In all other situations, it would fall to the pharmacy portion of the plan.
If you would like to enroll in a Humana plan, you have two ways to do so. The first is to call Humana at 1-800-824-8242, or you may fill out the paper application that was included in your enrollment kit. We would like to share with you what you can expect to receive in the mail once you enroll in the Humana plan. You will receive a letter from Humana once the Centers for Medicare and Medicaid Services, or Medicare, confirms your enrollment. After you receive that enrollment confirmation letter, you will receive your Humana ID card. Please use your Humana ID card when you obtain services both from your doctors, hospitals, and pharmacies. You will only need to use your Humana ID card. The last piece that you will get in the mail is your evidence of coverage. Your evidence of coverage will arrive after your ID card, and this is the detailed plan document that talks about all the specifics of how your plan covers services. This will also include your privacy notice. Humana has a tool called Physician Finder where you are able to look up which doctors, hospitals, and providers are in the Humana network. You can access this tool by going to humana.com, or you may call the number on the back of your card and a representative is happy to help you find a provider within Humana's network.
In addition to medical and pharmacy benefits, Humana is also including extra benefits and resources for our members. Humana at Home is what we call our chronic condition program. Eligible members will be contacted by Humana to see if they're interested in participating in the program. It is optional, but we do encourage people to work with our clinicians within the Humana at Home program. In no way are they trying to replace the relationship that you have with your physician. This is just an extra resource for our members. Silver Sneakers is a partnership that we have which offers our members free gym memberships nationwide. You can go to silversneakers.com to see where the closest gym is to your home, and you may also call Humana and we're happy to assist. Humana includes a nurse advice line, which we call Humana First. This nurse advice line is available to our members 24 hours a day, 7 days a week. If you would like to have a visit with a physician for minor conditions, we do offer the option of virtual visits. The program that we utilize is MD Live, and with the MD Live program, you are able to have an office visit with a physician from the comfort of your home. My Directives is an online resource available to our members at no additional cost. This beneficial planning tool enables members to develop an advanced directive which provides instructions to your family members and your physicians regarding your care wishes should a medical emergency arise. The Humana Welldyne program may be used after your inpatient stay in a hospital or a skilled nursing facility. You may be eligible for 10 healthy pre-cooked frozen meals that will be delivered to your home at no additional cost. My Humana is your online resource for personalized health benefits information. You may review your plan benefits or use the health and pharmacy tools to look up medical or prescription claims. You can register for My Humana from humana.com, and you will need your member ID number, at which point you will set up a login and a password. In addition to looking at claims, you're able to search for an in-network provider. You are able to review our drug list, and you also have information regarding other benefits and resources that are available to you. Humana has developed something called a SMART Summary. The SMART Summary is a monthly summary of all of the claims that Humana received in the prior month. As an example, in February, you will receive a SMART Summary that will detail the medical claims that Humana received in January, or detail the pharmacy claims that Humana received in January. If you did not have any claims in the prior month, you will not receive a SMART Summary.
Humana has a dedicated customer service team for our group Medicare members. You may call our customer service team to answer any questions that you might have in regards to your plan. They are available Monday through Friday from 8 a.m. to 9 p.m. Eastern. If you call after hours, please leave a message and we will return your call within 24 business hours. The customer service number is 1-800-733-9064. Thank you for taking the time to listen to this presentation. Please refer to your enrollment kit for detailed information in regards to your plan, and you are always welcome to call our customer service team.